Hi, year 8 biologists. We're going to actually have a whistle-stop tour of two topics in this week's lesson. 11.2 legal recreational drugs is the first one. It's going to be whistle-stop because I have already covered with you previously the dangers of shisha. So I will put some reminders of that topic in the lesson for you to just read through. It's going to be one of the activities, I believe. And really what I want you to do is, in this lesson, I really want you to focus on the health aspects, okay? 11.2 talks about smoking and it talks about alcohol, but please bear in mind that the second part of 11.2 covers the guidelines, the government guidelines in the United Kingdom, which are not the same as the government guidelines in the UAE. Okay, so that's just a little bit of extra additional information you need to know. Okay, so we have already covered the number of people who actually die from smoking in the UAE. We've also talked about shisha as well. Now, smoking-related deaths are mainly due to cancers, blockages in the lungs, and heart disease. Smoking does kill, and it is a sad thing as well. It's so for many of you, it might actually bring about some very unhappy memories. Perhaps you knew a loved one who has passed away, and you have my condolences for that. And it's long been known that smoking causes lung cancer and other illnesses. So even with that fact, why is it that so many people smoke? Well, it's even more surprising that young people start to smoke. And many adults want to stop smoking but find it difficult because nicotine, which is the chemical inside cigarettes and tobacco, is a very addictive drug. If they do not get a regular fix of nicotine, they suffer withdrawal symptoms and crave a cigarette. Basically, you have very little control. It's like as if your brain is saying that you need to have a cigarette, and before you know it, it's something that has to happen. Besides being addictive, nicotine also affects the circulatory system. Now, the circulatory system is, of course, your bloodstream and your heart. It's a stimulant, so it increases the heart rate. That means it increases the number of times it beats per minute. And it also makes the blood vessels narrow. So a narrowing blood vessel, be it an artery, a vein, or a capillary, will actually have less space inside, and so less blood can flow through it. And what that does is it kind of like puts pressure. Now you can imagine that this could happen with something like a soft drink. So here I have a soft drink, okay? And what I'm going to do with this soft drink is I'm going to sip it, so you can see, right? Sip, sip, sip. And now what I'm going to do is I'm going to pinch the top, because what I'm going to do is I'm going to model how smoking narrows the arteries, and I'm going to see how much I can drink as a result. It's very, very difficult. And what I actually have to do is I have to work that much harder. I think I've spoken about 100% healthy living anyway, but before. But I have to work that much harder. And you can imagine if you were drinking through a straw, that's got a pinch, you have to work that much harder. And can you imagine if you had to work that much harder, what would happen to the pressure of the blood if it was the heart that had to work that much harder? Well, the answer is that it would have to pump much harder and the pressure would actually go up. And that's all fine and well. You might think, well, that's great. The blood can actually get to where it's needed faster. The problem is that some of the blood vessels are actually very, very thin, particularly around the heart. They're called coronary arteries. And if you were to have high blood pressure going through there, it could have a catastrophic effect on life. So that's why we're worried about high blood pressure. You always get health messages to say, do everything that you can to lower your lower your the work that you put on your heart, your blood pressure. So, nicotine is a stimulant, it increases the heart rate, it makes the blood vessels narrow, and less blood reaches the cells. Now, this can lead to high blood pressure and heart disease. Okay. So with heart disease, what you can also have is you can have parts of the heart that aren't actually working anymore. Perhaps they've actually got some damage in them. That can happen through atherosclerosis, and you should be able to remember that you did a poster in the first term on atherosclerosis. So again, I'm going to be giving a quick reminder of that when you actually look at the slides. Okay. So this is actually what a picture of the tobacco plant looks like. It produces a toxic chemical, nicotine. Nicotine's not very healthy for you. Okay, it's actually a poison. If you have it in large amounts, you will feel quite well. So that toxic chemical nicotine is actually used to deter insects and grazing animals from eating it. So why did people start smoking the leaves? Well, it's probably because of the addictive effect. Perhaps they burnt it and then they suddenly felt quite cool about it. They probably thought, well, actually, this is something that is quite surprisingly relaxing or something like that. But maybe that was perhaps what happened with the first cigarettes. So cigarette smoke contains the other harmful chemicals. So we talked about we talked about nicotine being the addictive drug. Okay, don't think that nicotine is the black substance or a yellow kind of substance that's contained inside cigarettes. The nicotine is actually the drug. That's what tells your brain you need to smoke more. Okay, but there are other chemicals inside it, such as tar and carbon monoxide. Now, carbon monoxide is a colourless, odourless, tasteless gas, but if that carbon monoxide gets through into your body, then you have less oxygen that's reaching your muscles because the carbon monoxide latches onto the red blood cells preferentially. It stops the oxygen from latching onto the red blood cells. And the tar is a very thick liquid that settles at the bottom of your lungs, and within that liquid, because it's very, very hard for the tar to be pushed out of the body, so it can be a breeding ground for bacteria. So tar is a sticky poisonous substance that contains cancer-causing chemicals. It collects in the airways in the lungs. It stains teeth, skin, and hair a brown colour. Carbon monoxide is a poisonous gas that reduces the amount of oxygen that is carried in the blood. The smokers are often short of breath due to the effects of these chemicals. Now, a pregnant woman who smokes is putting her baby at risk. The baby does not get enough oxygen due to carbon monoxide in the mother's bloodstream, so it does not grow as healthily as a non-smoker's baby. This means it could be born too early or it could die. So only a small proportion of women smokers carry on smoking after getting pregnant. So I think you can realise why it is that most manage to give up, because they put the needs of the child ahead of them. Alcohol. So last week we learnt about alcohol. We learnt that it was a depressant drug. Small amounts make you feel relaxed, but your reactions are much slower. And this is why it's illegal to drink and drive, certainly in the UAE. Larger amounts of alcohol have a dramatic effect on people's behaviour. Some people become argumentative, they become violent, or may become unconscious. They may also suffer a hangover the next day. Long-term alcohol abuse affects relationships and job security. It is also an addictive drug. It's poisonous, and excessive amounts cause liver, kidney, and brain damage. Now, many alcoholics die from alcoholic poisoning or liver disease. Now, this is a diagram that shows you the different stages of liver disease. So you can see what the liver is. The liver gets deposits of fat, and that causes the liver to enlarge. You then get a condition called liver fibrosis, where scar tissue forms. More liver cells get injured, and injury occurs. And then eventually you have cirrhosis. Cirrhosis is where you have scar tissue, and that makes the liver hard and unable to work properly. So the effect of alcohol is well documented. Being drunk can put someone in a very embarrassing or dangerous situation. Okay? So that pretty much summarises all of the health aspects that you need to be covering for alcohol and for nicotine and cigarettes. Now we're going to talk about illegal drugs. Now, cannabis has been used as a painkiller in Asia for about 6,000 years. So it's a very well-known plant. The Romans used to fry and eat cannabis seeds, but today some multiple sclerosis sufferers also use cannabis legally to ease their severe muscle tremors and pains, and these people want cannabis to be legalized. So they want it to be free at the point of usage, but cannabis is not a legal drug within societies. So there are very few societies actually that allow it. The Netherlands is actually one example, but it's very much controlled. So, illegal drugs in the United Kingdom are classified into three groups, Class A, B, or C, depending on how harmful they are to users and society. It is illegal to have, to produce, to give away, or sell any of these drugs, and many of these rules are much the same in the UAE as well. Class A drugs are thought to cause the most serious harm and so carry the greatest maximum penalties for breaking the law. Now, cannabis has many other names known, including grass, weed, hashish, skunk, pot, marijuana. It is an addictive Class B drug. It's considered so harmful because it contains many other chemicals. Some of these do cause cancer and others cause mental health problems. And cannabis does alter your mood, your coordination, your ability to think, and your self-perception, the way that you see yourself. And some people who use cannabis do hallucinate, or they develop an irrational fear. They may become anxious or depressed and have problems with remembering things. So cannabis is sometimes highly sought after. So this is an example of an illegal cannabis farm. That could be in a farmyard, or it could be in a household as well. In the United Kingdom, the police actually use heat sensors at night time to see people's roofs, and when they observe people's roofs and they're exceptionally warm, the suspicion is aroused. I'm going to talk about cocaine now. And cocaine is a drug that's also known as coke, freebase, and crack. It is a Class A drug in the United Kingdom that is very addictive. Now, it's produced from the leaves of the cocoa plant. It's a stimulant. So people feel temporarily confident and alert. It's also an anesthetic, which is used medicinally, and a painkiller. People who use cocaine usually sniff it or smoke it. When the feeling of happiness and self-confidence starts to wear off, people can become depressed and tired for several days afterwards. Now, did you know that the original name for Coca-Cola was from coca leaves, which is the plant that we get cocaine from? But today, only cocaine-free coca leaf extract is used in Coca-Cola. The third drug we need to talk about is heroin. So, heroin is a Class A drug. It's a very dangerous drug. It's the most addictive recreational drug used in the UK. It's produced from the opium poppy. Opium is a sticky liquid that is collected from an opium poppy seed pod. It contains the chemical morphine, which is a legal drug used to treat severe pain. The use of morphine is carefully monitored to prevent patients becoming addicted to it. So as you remember, I was in hospital because I had some operations earlier this year, and because of the pain level, they administered morphine with me at the point where the pain was really, really too much to bear, and it is very, very effective. But they had to be very careful about the amount that they had to give me to make sure that I wasn't addicted. Heroin is produced from morphine, as is twice as potent. Both of these drugs are depressants, but they make people feel happy and relaxed. They also can cause sleepiness. Many heroin addicts inject the drugs into veins, and this can damage the blood vessels, and it can cause blood clots and infections. So if people inject a recreational drug, they also risk developing severe infections like hepatitis or HIV from using infected needles. An overdose of heroin can cause breathing to stop, leading to death. And an overdose can actually happen much easier than you may think, because when a heroin addict is taking heroin, they do not necessarily know how concentrated the drug is that they have access to. Risks of buying illegal drugs. Any drug bought from a drug dealer has additional risks. You do not know exactly what you are getting or how strong it is going to be, as I mentioned before. Some people have died after taking a drug for the first time. Dealers mix drugs with other ingredients to increase the weight and therefore increase their profits. Sometimes they use sugar, starch, or talc, but glass, pesticides, and other poisonous substances have also been used. See, dealers only care about making money, so they push people to use more and more. This leads to addiction and a drug dependency that costs a lot of money. Many drug addicts resort to criminal activities to buy more drugs. I certainly hope that after learning all of this information, it helps you to make the right informed choices in the future. see you back on the classroom, and I've got a couple of activities to take you through just to quiz you on your knowledge, your new knowledge of illegal drugs and alcohol and smoking. Take care, stay safe, bye for now.